Okay, well, this is what we have since... Alright, hello everyone. I just wanted to come on and make a video about burnout. Even though I tried my best during the second part of the pandemic to avoid working in a way that leads to burnout, I still have it. And I think it was especially like the first year and a half of COVID that honestly like really took a toll on me. They didn't really have very good boundaries for work and life, and it was all meshed together anyways because everyone was working from home and it was an unprecedented situation. So people, because it was unprecedented, I think people just, the expectations weren't really set out. I don't know, and I've just been, I don't know, wondering, I've just been wondering to myself, when am I gonna feel normal again? Because I was in such an elevated state of stress for so long that I feel like I cannot get out of it. And I feel like so empty and hollow and struggling, and I feel very lost now that everything's over. Now that I am not working, I just feel really lost as to like what I should do next. And yeah, I guess also like I just want to know, do other public health professionals and other like hospital workers have this after having worked the pandemic for 3 years? Or am I just like the only one? Because I just keep asking myself, when am I going to feel normal again? And I just don't know if I'm going to, which sucks. So yeah, I've been trying to like work out every day and obviously treat myself a little bit, okay? Gotta get an Americano at Starbucks. But yeah, I just have been really like struggling with that. And I mean, obviously like the hospital workers, what they did was a lot different than what I did and like what people in public health did. But yeah, I don't know. I just feel really, in addition to feeling super burnt out and just like a lot of unease generally, like I'm still in that like elevated state of stress, I also feel a lot of heartbreak, I realized, because I feel like going through that experience, it broke my ability to hope and feel like I was able to make a difference through public health and through, I mean, like global health is a little bit different, but yeah, just working in that context, it just, you're so far removed from the communities, and you can't, it's like really difficult to track like what one action results in. So yeah, I'm wondering, I don't know, I'm just wondering like, am I gonna feel normal again? And I mean, like, I guess I'm just wondering, like, does what I do or what I did make a difference? Did it make a difference? And can it make a difference going forward? And I feel really jaded about that because of the way that public health is funded in this country. It depends a lot on like the political atmosphere, because Congress controls a lot of funding, and then obviously like states have taxes and they have a budget for public health most of the time, but there's almost always an element of politics influencing public health. And so that makes it really challenging, because when you have to go and do your programs based on an election cycle, or you're thinking like, you know, your funding could change, that it's really difficult to do programs. And I don't know, especially like community outreach type projects, which, you know, it's really hard. Like, you don't really see public health doing that as much anymore, or doing campaigns to, I don't know, like prevent, for example, like prevent heart disease, or like, you know, lower sodium intake. God, like Americans eat way too much extra salt. And that's because our food is saltier than shit, because the companies that make it know, like, they aim for the bliss point or whatever. But that's all just to say, like, I mean, even though there are some public health programs that are funded long term, and generally the funding is renewed, there just is so much more that could be done and isn't. And also, I will say, it just is really hard to feel like you're making a difference when we have the medical system that we have. And it's like, okay, even if you tell people to go get screened for blood pressure, like, are they going to be able to afford $200 a month for their blood pressure medication? You know what I mean? So, or are they, you know, if you screen them for diabetes and it turns out they have type 2 diabetes, are they going to be able to afford to buy healthy food? You know? So it's just really disheartening. And yeah, I guess that's the heartbreak I've been dealing with. Is I went into global health and into public health to try and help at a systematic and a higher level. And, you know, like, there are just a lot of barriers to that being effective that obviously COVID showed us, you know, some of those barriers. But in general, you know, the funding issue, and then the health system, and these other, I mean, I don't know if I want to call it social determinants of health, but like socioeconomic status also plays a key role in health. And that is something beyond what public health can fix. We can only give information, educate, try and keep people out of the emergency room, you know, try and help that way. And, you know, if there are outbreaks of cases, try and do something to help prevent those. But I don't know. There's just a lot of barriers that influence like someone's health. So yeah. I hope that I can find my way back to the reason I went into global health in the first place, which was to help try and address disparities and, I don't know, just help, I guess, and make, you know, change at a very large level, at a high level. You know, at the population level, you think and you hope you're having a big impact. But yeah, I've just been feeling really disheartened about that, and also just still feeling so burnt out. And I just don't know, like, I feel like everyone got over COVID, you know, like everyone's getting over COVID, but I just feel like I'm stuck in this place where it's like, I don't know, I feel like I am not normal like I was before. And also, yeah, I don't know. I guess that's it. Yeah, that's kind of just what I wanted to say. So, good luck with your week, everybody.